Wonderful. Welcome, everybody. Lecture 10 today. Two main topics, medical mathematics. This is the second part, and then documentation and medical records. Let's begin with the first one. Today we will analyze dosage, medication, some new formulas, and then some conversions that will be already very familiar to basic formula for calculating a medication dosage. So as you can see here, there's a very basic equation here to get the X, where D is desire, A is available, and Q is quantity. More specifically, with the letter D, we identify desired as in the dosage that the provider order. Okay? With the letter A instead, available, the strength as stated on the medication label. Also very important, because we have to spend enough time making sure that we read the medication label properly. And finally, letter Q for quantity, the volume that the dosage strength is available in, such as capsules, tablets, or ml. Calculating dosage expresses ratio or percent. Now this is something that we need to pay attention. It's straightforward, but we want to make sure not to confuse one with the other. Percentage solution is the first thing we're going to address here. Express the number of grams of the medication per 100 ml of solution. Example, for calcium gluconate 10%, this is equal to 10 grams of pure medication per 100 ml of solution. Okay, so 10 grams per 100 ml. Ratio solutions express the number of grams of the medication per total milliliters of solution. All right. Example, epinephrine, 1 divided by 1,000 is equal to 1 gram of pure medication per 1,000 ml solution. All right. IV, intravenous flow rates. Monitor IVs every 30 minutes for adults and every 15 minutes for children. This is a rule of thumb. If the intravenous is running behind schedule, collaborate with the physician to determine the client's ability to tolerate an increased flow rate, particularly those clients with cardiac, pulmonary, renal, and neurological conditions. Okay, it's really more important. The nurse, the healthcare provider, should never arbitrarily speed up an IV to catch up if the IV is running behind schedule. Now, it is important to understand that we need to modulate and understand our own emotions. Nobody would like to find themselves in a situation when they notice a mistake or whether things were not prepared as they were supposed to. But it's even more important not to let this emotional state have a negative effect on the safety of the patient. So we should always collaborate with the rest of the treatment team to make sure that those things do not happen. IV flow rates. Whenever an IV rate is increased, the nurse should assess the client for increased heart rate, increased respirations, or increased lung congestion, which could indicate fluid overload. Again, heart rate, increased respirations, or increased lung congestion. Okay. IV fluids are most frequently ordered on the basis of milliliters, again, per hour to be administered. The volume per hour order is administered by adjusting the rate at which the intravenous infuses, which is counted in, keep this in mind, it's a very important notion, drops per minute, abbreviated as GTT, okay, from gutta, Latin. Drops per minute, GTT. We will utilize this in the several slides here, especially the next 2 or 3. Most flow rate calculation involve changing milliliters per hour into drops per minute. Again, drops per minute, GTT. So let's apply these basic formulas for IV calculations. Flow rates, total volume per GTT factor, okay, divided by time in minutes, GTT per minute. Infusion time, total volume to infused, by ml per hour being infused. That is equals to infusion. Moving on, intravenous tubing calibrated in GTTs per milliliters, and this calibration is needed for calculating flow rates. A standard or macro drip set is used for routine and IV administrations. Depending on the manufacturer and type of tubing, it will require 10, 15, or 20 GTTs equal 1 ml. The calibration in GTTs per ml is written on the IV tubing pad. Continue. A mini drip or micro drip set is used when more exact measurements are needed, such as intensive care units and in pediatric units. In a mini drip or micro drip set, 60 GTTs is equal to 1 ml. Few images here versus microdrip and a 20 as opposed to 60. Electronic IV flow rates regulators. Controller, let's focus on this, works on the same principle of gravity as a regular intravenous drip, with the rate of flow being maintained by rapid compression and decompression of the IV tubing by the machine. The desired flow rate is set on the controller in milliliters per hour. Because controllers work by gravity, the height of the solution bag is critical and must be maintained at a minimum of 36 inches above the controller. Okay, let's repeat this because it's really important. Otherwise, the cycle repeats. Because controllers work by gravity, the height of the solution bag is critical and must be maintained at a minimum of 36 inches above the controller. Let's talk about pump. Okay, so a pump is different from a controller in that it physically pumps fluid against resistance. Gravity is not a factor in the use of a pump, and the height of the IV solution container is not a critical factor. The flow rate on a pump is set in milliliters per hour. The nurse should continue to assess the amount of IV solution in the IV container and monitor the pump or control to assure proper function. Infusion ordered by unit dosage per hour. The most common medication that will be ordered by unit dosage per hour and to run by continuous infusion are heparin sodium and regular insulin. Calculation of this problem requires a two-step process. First, determine the amount of medication per 1 ml, and then determine the infusion rate or milliliters per hour. And you can see an infusion pump here in the image. Let's do some basic review just because we utilize mathematics in healthcare, in all profession and throughout any shift. So let's do a basic review of some of the conversions we studied in previous lectures with a few more examples. Conversion between metric units, part 1. There will be a part 2. Next slide. Problem. Convert 2 grams to milligrams. If you recall from our previous lecture, milli is Latin for 1,000. So solution, we need to change a larger unit to a smaller one. So move the decimal 3 places to the right. All right? So if you had 2.000 grams, right, this is equivalent to 2,000 milligrams. Okay, so 2 milli, so 2 milli in Latin. Problem, second part of this conversion. To convert 200 ml to liters solution, this time change a smaller unit to a larger unit. Move the decimal 3 places to the left, so 200 ml is equivalent to 0.250 L or 0.25 L. Always keep in mind that in healthcare we should keep the 0 in order to avoid mistakes. The next conversion, pounds to kilograms. There are 2 methods that may be used to convert pounds to kilograms. The first one, pounds divided by 2.2, as a result gives you the number expressed in kilograms. Therefore, if you need to convert kilograms to pounds, you utilize the weight in kilograms, you multiply that with 2.2, and you will have the number expressed in pounds. Example here, 100 kilograms, you do the multiplication, 2.2 is equivalent to 220 pounds. 32 kilograms is equivalent to 70 pounds. An advice that I have is also to memorize a few basic conversions so that you will be able to assess right away the validity of your conversion. So ratio and proportion. 2 ways to express a ratio separated by a column, as you can see in parentheses here, 50 mg divided by 1 ml, or written as a common fraction 50 mg over 1 ml. Proportion used to show the relationship between two ratios, either separated by an equal sign or by a double colon. You can see both this in parentheses. Example, 1 divided by 50 is equal to 2 divided by 100, or the same thing expressed with the double colon, 1 over 50 is equal to 2 over 100. Problem. A dosage of 200 mg must be prepared from a solution strength of 80 mg per ml. Solution, 80 mg divided by 1 ml is equal to 200 mg divided by the x, which is the number we want to find expressed in ml. So this is 80 divided by 1 equal to 200 divided by this x. So 80 times x is equal to 200. Therefore, our x is 200 over 80 divided by 80, and therefore 2.5 ml. Desired dose. The amount of a particular medication to be administered. This is a basic description, a basic meaning of the word. Okay. The symbol dash, which is expressed here, stands for PERP, or PEA in Latin. A patient with chest pain needs to be given 4 mg of morphine sulfate for chest pains. So 4 mg in this example is the desired dose. Medication to be administered. The patient is to be given dopamine at 10 mg per kilogram per minute. Okay? The patient weight is 220 pounds, so we need to first convert pounds, so 220 divided by 2.2 is equal to 100 kilograms. So 1000 mg per minute is the desired dose, right? So 100 kilograms, 1000 mg per minute. Wonderful. So let's continue. A physician orders 25 mg of Benadryl to a patient with itching and hives. Benadryl is supplied 50 mg per 2 ml. What is the desired dose? Another example. A patient with hypotension is ordered to receive dopamine at 5 mg per kilogram per minute. The patient weighs 275 pounds. Your dopamine makes 100 mg in 500 ml. So what is the desired dose? Do your calculation. Keep in mind you need to convert pounds to kilogram, and you will get 625 mg per minute. Pediatric patients to receive atropine 0.02 mg per kilogram. The patient weight this time is in 18 kilograms. Okay, so what is the desired dose? Same calculation, and the answer is 0.36 mg. All right, so let's take a look at some basic information regarding labels. The medication label will contain both the generic and trade brand name of the medication. The trade name, also called brand name, is printed on the label in capital letters or with the first letter capitalized. The generic name is the chemical name of a medication. The generic name may not be capitalized and is usually located below the trade name on a medication. As an advice, it's always important to remember the generic name, especially because brand names might not be the same if you move to a different geographical area. Each medication has only one official name, but may have several trade names, each for the exclusive use of the company that manufactures the medication. Always check expiration dates on medication label. In a medication order, the name of the medication is written first, followed by the dosage, route, and frequency. If there are any question or inconsistency with the written order, the person who wrote the order must be contacted immediately, and the order must be verified. Really important. What are the components of medication orders? Name of the client, date and time when the order is written, name of the medication to be given, dosage of the medication route, remember that 5 R's, right? Time and frequency of administration, and finally, very important, signature of person. Oral medication scored tablets contain an indented mark to make possible breakage for partial dosages. When necessary, scored tablets, those marked for division, can be divided in halves or quarters. Enteric-coated tablets and sustained-release capsules delay absorption until the medication reaches the small intestine. This medication should not be crushed. Oral medications, again, capsules contain a powdered or oily medication in a gelatin cover. Oral liquids are supplied in solution form and contain a specific amount of medication in a given amount of solution, as stated on the label. Volumes of less than 5 ml are measured using a syringe with the needle removed. A calibrated dropper is used when giving medicine to children and when adding small amounts of liquid to water or juice. Calibration is important are in milliliters, cubic centimeters, drops, or minims. And the next slide, we'll see a medicine cup. The medicine cup has a capacity of 30 ml or 1 ounce. Is used for oral liquids. It's calibrated to measure teaspoons, tablespoons, and grams. Or accurately, hold the medication cup at eye level, as you can see here in the image, and then line up the measure that is needed. Or parenteral always means injection route. And parenteral medications are administered by intravenous, intramuscular, or subcutaneous. Parenteral medications are packaged in single-use ampoules, single and multiple-use rubber stopper vials, and in pre-filled syringes and cartridges. Moving on, parenteral medications. Parenteral always means injection route, and parenteral medications are administered by intravenous, IV, intramuscular, IM, or subcutaneous, SC route. Parenteral medications are packaged in single-use ampoules, single and multiple-use rubber sub-vials, and in pre-filled syringes and cartridges. You can see some images here, medication vial and ampoule, and of parenteral medications. Few things to keep in mind. The provider should not administer more than 3 ml per IM or SC injection site, as volume larger than 3 ml are difficult for a single injection site to absorb. Always keep in mind that if there's something that does not make sense, we should always go back and check. Always question excessively large or small volumes of medications. That's what we mean. The standard 3 ml syringe is used to measure most injectable medication. It is calibrated in 10 0.1 of a milliliter. The calibration of a syringe are read from the top black ring on the syringe, not the raised middle section, and of course not the bottom ring. Here, there's an image of a standard 3 milliliter syringe. Now let's talk about medication concentration. The concentration is found by dividing the weight by the volume. For instance, 50 mg per 2 ml, right? So you divide 50 milligrams by 2 ml. The answer will result in the concentration per ml of medication. In this context, 50 divided by 2, 25 mg per ml. Example. Phenergan is ordered 12.5 mg. It supplies 25 mg per 2 ml. What is the concentration? The concentration is 12.5 mg ml. Examples, lidocaine is ordered 2 mg per minute. It is supplied 2 grams per 500 ml. What is the concentration? The concentration is 0.004 grams per ml, or 4 milligrams per ml. Thousand. Another example, morphine is ordered 5 mg. It supplies 10 mg per 4 ml. What is the concentration? The concentration is 2.5 mg per ml. Diazepam is ordered 5 mg. It supplies 10 mg per 2 ml. What is the concentration? The concentration is 5 mg per ml. Dopamine is ordered 5 mg per kilograms per minute to a 200-pound patient. It supplies 800 mg per 500 ml. In this case, what is the concentration? The concentration is 1.6 mg per ml, or 1,600 mg per ml. Few things to keep in mind when talking about a cartridge holder. Tubex and Carpaject are the trade names of two widely used reusable metal or plastic cartridge holders. The medication cartridge slips into the cartridge holder, which provides a plunger for injection of the medication. The medication cartridge is pre-filled with sterile medication and is labeled with a medication name and dosage. The medication cartridge is routinely overfilled with 0.1 to 0.2 ml of medication to allow for manipulation of the holder to expel air for the needle prior to injection. The medication cartridge is designed to provide sufficient capacity to allow for the addition of a second medication when combined dosages are prescribed. The pre-filled medication cartridge is to be used once and discarded. Again, once and discarded. If the nurse is to give less than a full single dose provided, the nurse needs to discard the extra amount before injecting the client following agency policy and procedure. Medications. Standard medication doses for adults are to be rounded to the nearest tenth, which means 0.1 of a milliliter or cc, and measured on the ml scale. For example, 1.25 ml is rounded to 1.3 ml. When volumes larger than 3 ml are required, a 5, 6, 10, or 12 ml syringe might be used. These syringes are calibrated in fifths. Syringes larger than 12 ml are calibrated in full ml. And here we have an example of a 5 This is a tuberculin syringe which holds a total capacity of 1 ml or cc and is used to measure small or critical amounts of medication such as allergen, aspirin, vaccine, or a child's medication. It is calibrated in hundredths of a milliliter, with each tenth marked on the metric scale. Insulin syringe. The standard U100 insulin syringe is used to measure 100 insulin only. It is calibrated to 100 units or 1 ml. Insulin should not be measured in any other type of syringe. When the insulin order says to combine regular and NPH insulin, remember RN and draw R for regular insulin first, and then draw the NPH insulin. Final consideration, it is important to master the connection between dosage and body weight again. Calculation of medication dosage by body weight, so this should also be very, very familiar. Pounds to kilos, pounds to kilograms. 1 kilogram is equal to 2.2 to convert from pounds to kilograms, divide 2 by 2, kilograms expressed to the nearest tenth, kilograms to pounds, the opposite to convert from kilograms to pounds, multiply 2 by 2, 2.2, and pounds. Calculation of medication dosage by body weight. Again, let's review this. Dosage are expressed in terms of mg per kilogram per day, mg pounds per day, or mg per kilogram per dose. The total daily dosage is usually administered in divided doses per day. Express the child's body weight in kilograms or pounds according with the dosage specifications. Calculate the dosage and divide the total daily dosage by the number of. All these things are repetitive, but it's a really good practice to verify amount in the right formula. Another important thing to consider, especially when comparing body weights and surface area between adults and children, is the BSA, or body surface area. The body surface area is determined by comparing body weight and height with averages or norms on a graph called a nomogram. Not all children are the same size and the same age. Therefore, the nomogram chart is used to determine the BSA, the body surface area of a child, as you can see here with the corresponding percentages in the pictures. All right, medication calculation based on body surface area. When dosage recommendation for children specify mg, mcg, or dosage unit per m squared, so square meter, calculating the dosage is simple multiplication problem. The dosage recommendation is 4 mg per m squared. The child has a BSA of 1.1 m squared. What is the dosage to be administered? Solution: 1.1 4 mg equals 4.4 mg. Last slide for this section, medication calculation based on BSA. When dosages are specified only for adults, a formula is used to calculate child's dosage from the adult dosage. Problem: the physician has prescribed an antibiotic for a child. The average adult dose is 250 mg. The child has a BSA of 0.41 square meters. What is the dose for the child? Solution: BSA of a child, m squared, multiply by adult dose equals child's dose, 1.73 m squared. As you can see here in the equation, 0.41 over 1.73 times 250 mg equals to 59.24 mg. Let's move on to the second part of this lecture, documentation and medical records. You probably are familiar with a lot of things we will discuss here because we mentioned at least a few things regarding notes previously, but let's start with some very basic information. And this is yet another formula. We talked about the 5 R's and 5 P's, etc. These are the 6 C's of charting with big capital C. C as in client's words, clarity, completeness, conciseness, chronological order, and confidentiality. All right? So the 6 is of charting. Now, basic informations, updates, and errors. Correct mistakes immediately. All right. This is especially important if you're dealing with a patient and if you're also utilizing EHR or as in the paper. Draw a line through the original information, okay, in order to avoid possible misunderstanding. Okay. Insert correct information. Document what the correction was made. Date, time, and initial correction. Have a witness if possible. Addition should not appear deceptive, okay, so it should not contradict what happened before, right, in the previous note or the previous section of the note. Document what late entry is made, date initial added items, and may have a third-party witness addition, okay, depending on the context. Now, when we're talking about patient medical records, what we're talking about, what are the main things? This goes back to the various assessment we discussed in this semester. So important information: patient registration form, date, patient demographic information, age, date of birth, address, phone number, social security number, insurance, financial information, and emergency contact. And these, of course, all connection with other topic we discussed before, including advanced directives, guardianship, and so on and so forth. Physical examination result, review of systems, form ensures consistency, very, very important, especially because we utilize this, longitudinal sense as well. Results of laboratory and other tests, and documents for other sources. Keep in mind that the more integrative and holistic we are in providing this information, the better it is for the patient. Finally, the third part, well, not really finally, there are a few more. Diagnosis and treatment plan, treatment options and plan, instructions, medication prescribed, comments or impressions. Again, depending what type of intervention, whether the doctor is a surgeon or a psychologist, etc., etc. Operate reports, follow-up visits, and telephone calls. Hospital discharge summary forms, consent forms. This is, again, the ethical portion. Verify that the patient understands procedure, outcomes, and options, and the patient may withdraw consent. Also, is also connected to capability from the cognitive or neurocognitive psychiatry perspective, whether the is able to provide informed consent, for instance, whether they're able to understand the parameters of the intervention, even more so if the intervention is connected to require anesthesia, for instance, or in the context of a pilot study, etc., etc. Those are all things that are very important to include. A few more things: correspondence with or about the patient. Again, in context of a guardian, information received by fax. Always request an original copy, and date and initial everything you place in the patient's chart. Okay, virtually in context of EHR or on paper. Now, also important: patient medical history, past medical history, family medical history, social and occupational history, and history of present illness, which is the main concern, the chief complaint. Now, there are different types of medical records, and we mentioned this before. Source-oriented medical records. Information is arranged according to whom supplied the data. Problems and treatment are in the same form, and it's difficult to track progress of specific events. Are problem-oriented medical records. Database, problem list, each problem is numbered, sign versus symptoms, in terms of the etiology, in terms of the taxonomy, an educational, diagnostic, and treatment plan for each problem, and finally, SOAP notes. This is what we mean by SOAP documentation. Orderly series of steps for dealing with any medical case. List the following: patient symptoms, diagnosis, and suggested treatment. Now, we talked about the acronym SOAP before, subjective, objective, and plan, but there is another acronym that is also utilized, which we will explore in the very last 2 slides of this lecture. This acronym expands on the SOAP format, okay? It's called the chatter form, okay? From the initials of this acronym. C stands for chief complaints, presenting problem, subjective statements. H stands for history, social and physical. E stands for examination. Then the double D in chatter indicate drugs and dosage. A, assessment of diagnostic and diagnosis. And finally, R, return visit information or referral. Wonderful. So this concludes this lecture. I hope you enjoyed and you had the chance to review and practice some of those mathematical calculations. Thank you very much, and I will see you next week, which is week 11. Bye-bye.